Welcome to the opening session of the first meeting of the Society for Spirituality, Theology, and Health. You are inaugural members. I found it very gratifying tonight to have a number of people end up in one way or another saying, oh, one duo said, we've been writing together for 5 years and we've never met each other. And we met each other tonight at dinner. So that was that's exactly what we would be hoping for out of bringing you together in this meeting and on a yearly basis and in a very regular way to nurture a genuine sense of a community and a network of scholars, practitioners, and interested colleagues in this work in spirituality, theology, and health. We are honored to have you here. We count it a privilege that you have made the effort and taken the time out of your busy schedules. We count on the fact that it will be a time of genuine sort of personal engagement and personal growth, and that you will leave with a sense of that this has made a difference for you and that you are prepared to make a difference in this field of spirituality, theology, and health as we go forward as colleagues together. At this point, I would like to introduce you to a true leader in American medicine and a leader and truly senior statesman in our work here at Duke in the medical center and the university at large. He's the chair of the Department of Medicine and is the director of the university-wide Center for the Study of Aging and Human Development, Dr. Harvey Cohen.
Thank you, Keith. It is my great pleasure to, on behalf of the Duke University and the Duke University Medical Center, who join with the Center for Spirituality, Theology, and Health in hosting this conference, to welcome you all here tonight. It's really a terrific pleasure to look out and see this great crowd of folks coming from such diverse backgrounds, and to learn and teach in a scholarly and communal way. I have had the pleasure of watching the Center for Spirituality, Theology, and Health here at Duke grow from its pre-inception to its current flourishing status, and have watched with great pride as this development has taken place. I think Keith and Harold obviously are owed a great debt of thanks for having worked so hard over these years to really put this program together, which in a sense culminates tonight. It's not the end, but it culminates tonight in this first annual meeting of the Society of Scholars for Spirituality, Theology, and Health. We owe thanks to many people, but in particular we owe great thanks to the Templeton Foundation, who have supported this effort from its very beginning and have continued to support it very generously as it has built throughout the center, as well as from creating the society that will foster the work that you folks will be engaged in here today, tomorrow, and hopefully for a long time to come. It is, I think, everybody's hope that with this initial engagement in this program, that this will truly be a beginning, that you will feel that you have gained something by the interactions you have experienced here, and I'm quite certain that you will, having reviewed the tremendous program that's been put together by the organizers, the speakers who are here and who you will be hearing from over the next couple of days, who truly represent the best and the brightest in this field. I think there is no question that there will be a lot of learning going on. And in part, a lot of that learning will go on because you will be interacting with each other and bringing your own diverse experiences, the experiences from each of your disciplines to bear on the various questions that will be under consideration. So it is everyone's hope that with that background, that going forward, you will maintain a connection with the society, with the center here at Duke, and that can be a springboard for further scholarly activities and practical applications of the type of work that's so important. I believe that this is a critically important area of intersection of areas in the humanities, spirituality, and theology in particular, with medicine, health, and illness. In our current society, we very much need the input from all of the disciplines that can apply themselves to helping people live better lives. And I think that ultimately is what this is all about. So I just want to welcome you again, wish you the best in this conference. I'm sure it will be a useful, productive, and interesting one, and that you'll all have a very good time, and hopefully we'll get to see you again, at least at the second annual conference of the Society, to which I'm already looking forward. So welcome, enjoy, and we'll see you later.
It is so exciting to see you all here, and I'm joining Keith in welcoming you to this, really what I think is going to be a historic conference. So this is so exciting. Now I have the true pleasure and honor of introducing Dr. Jack Templeton. Now this is not difficult to do this task at all. And, you know, Jack came up to me and in his typically humble fashion said, you know, just take about 10 seconds and then get me up there, you know. But I had to say, Jack, I can't do it. I've got some things that I want to say, and I'm going to say those things. Dr. Templeton serves as president of the John Templeton Foundation, and he directs all of the foundation activities, working closely with the staff of the foundation and an international board of more than 50 leading scholars. Dr. Templeton has been actively involved in the foundation since its inception in 1987, but in 1995, he retired from his medical practice to serve as full-time president of the foundation. Dr. Templeton holds a bachelor's degree from Yale University, a medical degree from Harvard Medical School, completed his internship and residency in surgery at the Medical College of Virginia, and subsequently trained in pediatric surgery under Dr. Everett C. Koop. After spending 2 years in the U.S. Navy, he returned to the Children's Hospital of Philadelphia in 1977, where he served on the staff as pediatric surgeon and director of their trauma program. He also served as professor of pediatric surgery at the University of Pennsylvania. Now that's the formal introduction, but I have a bit more to say that's on a more personal note. In the last 10 years, I have experienced Dr. Templeton as a careful and rigorous scientist on the one hand, and on the other hand as a remarkably generous, kind, and faithful man. I'd like to share with you an example. When my son was having problems in his preteen years, Dr. Templeton and his wife Pina, who is with him today, invited my son to spend a day with them. They fixed a beautiful dinner and gave him a big red plate. He sure felt special with that big red plate. I'll never forget how big his eyes got when his favorite dessert arrived, an entire bowl of maraschino cherries. After dinner, Jack took him aside and gave him a coin book to encourage him to save his money, and discussed with him the principles of earn all you can, save all you can, and give all you can. The next day, Jack and Pina spent the entire day showing him the sights of Philadelphia and its many historic landmarks. It was a time he has not forgotten. Now let me ask a question. How many people in Dr. Templeton's position of power and influence would take this much time and effort to help out the son of a colleague, particularly a colleague that he really didn't know that well? This was 7-8 years ago, and one that could certainly do very little for him in return. But that is the way Jack is. He makes everyone feel special, just like his dad, Sir John Templeton, has done for over 3/4 of a century. I've got many other stories that I could tell about the way Dr. Templeton treats his colleagues, co-workers, and staff, the way he makes them feel appreciated and brings out the very best in them. But I know you're tired of listening to me, and I want to hear, and you want to hear, what this extraordinary leader and man of character has to say. So please join me in welcoming Dr. Jack Templeton.
Well, thank you, Harold. That was really more kind and more deeply appreciative, especially the wonderful weekend that we had with your son and really your whole family. So thank you very much. Although my father, Sir John Templeton, is not able to be with us for this conference, he wants me to share with you his deep gratitude for all of your efforts to bring to bear excellence in one of the most time-tested, intuitive concepts among people all over the world. That concept involves the impact of spirituality and religion in health and healing. I have entitled my talk, Patient Respect, Patient Dignity, Patient Outcome. Because of my father's long-standing interest in this nascent field, the involvement of the John Templeton Foundation in spirituality and healing and medicine was one of the first major endeavors the foundation undertook some 14 or 15 years ago. Our interest beginning in the early 1990s was very much stimulated by the input of Dr. David Larson, a psychiatrist who had become a leading proponent of coupling high-quality, broad-based scientific data on the issue of spirituality and healing and medicine to courses in this subject in American medical schools. My father felt that it was not enough to highlight the traditional heritage of many faith traditions in regard to prayer and meditation in the context of health and healing. He felt that the most important component was carefully designed, objective scientific studies that demonstrated first the correlation of spirituality and healing and medicine, and then opening the door to more challenging studies regarding mechanism of action. My own trajectory as a physician in regard to spirituality and healing and medicine came from the fact that in spite of my own inclination to pray for my patients, the academic and clinical world of medicine in which I practiced from the 1960s to the 1990s had a very secular attitude, an attitude which would have disdained or actively discouraged what they would have considered to be an intrusion if one addressed spirituality as a part of working with patients. When I went to medical school in the 1960s, the two burning issues were honesty and sexuality. In regard to honesty, it was clear by that time that because of rapidly advancing interventions for serious diseases such as cancer, you could no longer withhold information from the patient about the fact that he or she did in fact have a cancer, and that the treatments were directed at overcoming the cancer. Even then, we often faced emotional appeals from families saying, "Please do not tell mother she has a cancer, because it will break her spirit and she will give up." It became clear, however, that it was futile, in fact harmful for doctors to tell a cancer patient that they were going to receive powerful drugs that would cause them many serious side effects, or propose the use of radiation therapy just to treat an alleged infection. The second major issue in the 1960s was the need for doctors to be much more comfortable in addressing sexuality questions with their patients, particularly in regard to lifestyle or behavior choices that patients made that might have major implications in regard to their health and well-being. Prior to that time, doctors almost never addressed sexual behavior or practices with their patients. Again, going back to the early 1990s, two other factors represented a substantial breakthrough, not only for me, but for the medical profession as a whole. The first was to recognize through well-done studies by the Gallup organization and other survey experts that not only were Americans a very spiritual and religious people, but that over 70% of Americans welcome the idea of doctors discussing their spiritual perspectives with them, particularly in regard to health issues. Even more impressively, more than 40% of Americans indicated that they wanted their doctor to pray with them. The next major step was the recognition by Harvard Medical School that there was a substantial number of studies on spirituality and healing and medicine that warranted their sponsoring and endorsing a major annual conference on spirituality and healing and medicine as a part of their continuing medical education program. From the beginning, this annual conference has been organized and run by Dr. Herb Benson of Harvard Medical School. Among the several hundred studies which showed a beneficial effect of spirituality on health and healing, almost all of these studies were what I would call correlational. This typically involved the analysis of health status and, in some cases, healing from diseases, comparing patients who had a robust spiritual life, including daily Bible study and prayer, versus those with little or no routine spiritual life. Typical examples of these correlational studies included the following. In a survey of over 2,000 high school students in Ontario, more religious students had lower rates of substance abuse, including marijuana, hallucinogens, stimulants, barbiturates, and tranquilizers. In a study of approximately 250 men who had established addictions to opiates, those patients involved in a long-term religiously based program were able to remain free of addiction 1 year after the program was completed in 45% of the patients. This contrasted with the freedom from addiction rate of only 5% in patients participating in secular-based programs. In a survey of over 90,000 individuals in Maryland, those who attended church 1 or more times per week had at least 50% fewer deaths from coronary disease, emphysema, cirrhosis, and suicide compared with those who had little or no religious involvement. Also, a 16-year follow-up study of members of Orthodox kibbutzim in Israel showed that they had a 50% lower mortality rates from a variety of causes than non-Orthodox kibbutzim members. With healthcare costs beginning to rise substantially in the early 1990s, added attention was drawn to the impact of spirituality in health and medicine in regard to healthcare costs. Several earlier studies demonstrated the cost-effectiveness of working with and supporting a patient's religious and spiritual perspectives in regard to their health outcomes. For example, in a study involving open-heart surgery patients, 331 patients were randomized to have a chaplain intervention or usual care. Patients with chaplain intervention had a 2-day shorter postoperative hospitalization, resulting in an overall cost savings of $4,200 per patient. In another study, Flurl reported on a randomized study of patients undergoing orthopedic surgery. Half the patients received a chaplain intervention involving chaplain visits of 15 minutes per day. The other half served as a control group. The chaplain intervention program had a reduced stay of 29% and a reduced use of nursing services and pain medications by 1/3. As more and more attention was drawn to the growing field of spirituality and healing in medicine, a number of critics have sought to demean these studies, not only in regard to methodology, which is something that could always be improved, but also in regard to the fact that these studies were considered low class because they were only correlational studies. It is important for us, however, to remember the rich history of medicine in the past 200 to 300 years, just how many extraordinary breakthroughs occurred purely because of observation and correlation. For example, when Jenner recognized that milkmaids who contracted a disease called cowpox never came down with smallpox, he introduced the idea of inoculation on a mass scale in order to prevent smallpox epidemics. That was 200 years before the science of immunology helped us to understand how immunization actually worked. In another example, for hundreds of years, sea voyagers were plagued by a mysterious disease called scurvy. In fact, until the mid-19th century, many more sailors died of scurvy on military ships than ever died in battle. Then British doctors serving on long-range British ships made the correlational observation that consuming citrus fruits prevented sailors from coming down with scurvy. This discovery existed 200 years before the discovery of vitamin C and the science of tissue physiology. One other example involved the discovery by Semmelweis in Austrian maternity hospitals that if scrupulous hygiene, including regular hand washing, was done, death rates associated with maternal deliveries dropped dramatically. This discovery took place a long time before the science of bacteriology developed to help us to understand the nature and causes of infections. The John Templeton Foundation has also engaged another long-standing interest of my father, namely prayer. This included the nature of prayer and the impact of prayer. As already noted, prayer is widely practiced throughout the United States. One survey found that 82% of Americans believe in the healing power of prayer, and 64% feel that physicians should pray with patients who request it. Other studies indicated that between 35% and 43% of respondents engaged in personal prayer for good health or for healing within the last year. One recent study found that prayer frequency was associated with lower cortisol response, reduced blood pressure in males, but for some reason elevated blood pressure in females. This kind of studies have begun to introduce the next stage in regard to a deeper analysis of the impact of spirituality and faith-based practices such as prayer on systems within the human body, especially in regard to endocrinology and immunology. Studies like these promise to contribute greatly to understanding the mechanism of action of spirituality and healing in medicine that were identified through many hundreds of correlational studies. For example, an exploratory study from 2001 examined the relationship between spirituality and immune function in women with metastatic breast cancer. Spirituality was assessed by patient reports of frequent attendance at religious services and the reported importance of religious expression. Results showed that both helper cells and cytotoxic T cell counts used as markers of immune function were greater among women reporting greater spirituality. As I mentioned, one of the world's early leaders in advancing spirituality in health and medicine was Dr. David Larson. His influence and the innovations that he provided in encouraging education about the growing science of spirituality and health as a part of medical education were substantial. On both the human level and the professional level, the untimely death of David Larson was a great tragedy. Fortunately, two early centers became vital components in sustaining the momentum that David Larson and so many others here tonight contributed to so much. In addition to the team at Duke University was the leadership role played by Dr. Christina Pukowski. She spearheaded the creation, launch, and vigorous activities in the newly established George Washington Institute for Spirituality and Health. Because my father was so intrigued with the strategic impact of a science-based spirituality and health curriculum in American medical schools, he had previously approved a major competition program of awards for the most outstanding spirituality and healing medicine curricula in medical schools and the dissemination of information about these model courses to other medical schools and to the public as a whole. He particularly endorsed the development of a relationship with the Association of American Medical Colleges, including the science of spirituality and healing, as a part of the national standards for medical education. As a part of this investment in medical school education by the John Templeton Foundation, the George Washington Institute for Spirituality and Health spearheaded workshops and posters at national conferences, including the Society of Teachers of Family Medicine and annual conferences of the Association of American Medical Colleges. Also, as a part of the outreach of this program, Dr. Pukowski authored articles that were published in leading journals such as the Journal of the American Medical Association and a variety of book chapters, interviews, and public educational programs. Subsequently, the foundation provided support to George Washington Institute for two other strategic initiatives. The first was a similar competition for outstanding curricula in residency training programs, particularly in internal medicine and psychiatry. This was intended to enhance insights and potential practices on the parts of young doctors in training, which it was felt would have an even greater application once these trainees went into practice. Finally, in 2004, the John Templeton Foundation invested resources to support a third step in advancing the field of spirituality and healing in medicine. By this time, over 80 medical schools in the United States had active science-based courses in spirituality and healing. It was recognized, however, that the final validation of this patient-centered approach involved educational outreaches and certification programs for practicing healthcare professionals. This grant involved the establishment of partnership programs with professional organizations and a speakers bureau to reach an even wider audience of opinion leaders in medicine and healthcare institutions. In regard to Duke University, the involvement of the John Templeton Foundation in the strategic impact of spirituality and health through research-based endeavors goes back to 1996. Because of the quality of early research and dissemination programs based at Duke, Sir John was very pleased to provide startup support in order to track the progress that he hoped would become a springboard for much greater leadership and mainstreaming of the field of spirituality and health. Therefore, one of our earliest investments was for a 4-year study to determine the impact of religion and spirituality on health service use during the year following hospitalization for acute illness. Among the 3 research papers which came out of this modest research grant was the finding that religious activities, attitudes, and spiritual experiences are prevalent in older hospitalized patients and are associated with greater social support, better psychological health, and to some extent, better physical health. Subsequently, the John Templeton Foundation invested additional support with Duke to provide core resources or infrastructure to expand the embryonic development of a center at Duke for the study of spirituality, religion, and health. The moderate amount of funds provided for this purpose contributed to an extraordinary output of 14 original peer-reviewed research publications and many other forms of outreach, including book chapters, editorships, and over 20 books. Because of the vigor and strategic impact during these earlier years at Duke, the team at Duke began to play a major role in 2 vital areas. First was assisting in the development of programs on religion, spirituality, and health at other major medical centers, and assisting in the mentoring of new and established researchers. As a measure of the increased credibility of the team at Duke, scientists at the center were awarded several grants to study the relationship between religion and health from the National Institutes of Health, the Center of Disease Control, and other private foundations, including the Arthur Vining Davis Foundation, the Fetzer Foundation, and the Mary Biddle Duke Foundation. One other major impact from the increasingly influential networking capacity of the team at Duke was its role in influencing public policy in order to increase federal funding in the area of religion and spirituality and health. This has included the work of Linda George, who was the director of Duke University's Institutional Review Board, and the active and influential voice of Dr. Dan Blazer as a member of the Institute of Medicine. In 1999, Sir John approved a book proposal with Dr. Koenig entitled Psychoneuroimmunology and the Faith Factor, to draw together some of the newest understandings of the actual mechanisms which appear to play a vital role in the increasingly manifest beneficial impact of religion and spirituality in health and recovery from illness. It was noted that there were already hundreds of studies that show a positive relationship between religion and health, and a growing number of studies showing a relationship with healing as well. As we saw earlier, critics continued to cite the lack of a deeper scientific study in regarding the mechanisms of how faith, religion, and spirituality can contribute to health and healing. The book project approved by Sir John derived from a major conference of 13 scientists who are leading investigators in the new and growing field of psychoneuroimmunology. Sir John also suggested ideas for the wider dissemination of results from this newly developing connection between psychoneuroimmunology and religion and spirituality and health. In August of 2006, the John Templeton Foundation invested seed money for the new Center for Spirituality, Theology, and Health, spearheaded by Dr. Keith Meader and Dr. Harold Koenig. What caught our attention were their plans for nurturing the field of spirituality and health in 3 ways. First, to create a community of scholars locally and beyond to nurture collegiality and to foster conceptual and methodological advances in the field. Second, to build a network of researchers by the establishment of a self-sustaining membership organization that holds yearly conferences and facilitates mentorship and research collaboration. And third, to develop an educational center of excellence for the field at Duke, where leading scholarship as well as training of graduate students and postdocs could prosper. This project was particularly strategic in regard to substantial leveraging of support from Duke and the community of scholars involved with this society. The expected output included numerous new research projects, new research grants, dozens of scholarly papers, and well over 100 presentations and other forms of outreach. The project fulfilled one of Sir John's long-standing interests for developing a network in conjunction with a growing number of other co-funders for a national and international body of scholars doing serious and rigorous work in spirituality and health. What also caught our attention were the center's specific goals of the development of fundable new research projects. These projects included those which looked at how participation in religious life and community can foster health and enhanced capacity for caring, how body, mind, and spirit interact in the human process. Next, the role of prayer, worship, generosity, forgiving, and gratitude in health. Next, the role of spirituality and health in the sciences and improved research methodologies. And finally, through collaboration and clinical research, the relationship between the dimensions of spirituality and health, thereby documenting the impact of new spiritual information through science. As noted in the follow-up reports, the entire team based here at Duke has already made significant progress in the following areas. First, in building a community in the field throughout the launch of monthly seminars with visiting scholars. Second, communications, particularly through the center's website, which has continued to expand. Third is education. The center's initiatives include both training of scholars and teaching. And finally, we greatly appreciate the research such as the current critically important National Survey of Administrators in Schools of Medicine, Nursing, and Public Health regarding the future of education in spirituality and health. Overall, in its relatively short existence, the center has demonstrated remarkable cost-effectiveness in terms of its productivity and its output. The center, therefore, is already becoming a model of stewardship regarding innovation, impact, and output. One of the very demonstrable components of this output is the very large number of paper and poster presentations for this meeting. The very productivity generated up to and including this meeting makes it clear that from the viewpoint of the John Templeton Foundation, this is a signature program which is laying a strong framework for mainstreaming the field and demonstrating sustainability. In conclusion, I would like to share some perspectives on what might serve as useful guidelines in achieving substantial research advances in the growing field of spirituality and health in medicine. The richness of this field involves two things. First is the primacy of the patient and his or her well-being. Second, part of the success of this well-being requires the combination of patient respect and patient dignity coupled with patient outcome. Medicine, just like justice, must be a two-way street. Our success in fostering a culture of health must reach much further than a one-way process of well-meaning delivery of services. Instead, in our research, we must find ways to uncover the spiritual, emotional, and moral inner core of patients, which can then play a critical role in impelling each patient to a positive embracing of his or her own health and well-being. In our emphasis on the power and impact that high-quality science can have, we need to step beyond our own personal intuition or instincts. In some cases, this will involve developing a much greater sensitivity to the importance of culture. In that regard, it is not sufficient for a project to be intuitively promising. Instead, it must be tested and piloted before being submitted to a full-blown scientific analysis. Let me share with you one example in which patient respect and sensitivity to culture led to a very revealing study with results that were widely applicable. One of the biggest problems for certain groups in America is for them to take what they learn and then put it into action. Consider the problem of getting parents to accept and properly use car seats for infants and children. It was noted that in working with Hispanic parents, no matter how much education was provided and how often the car seats were provided, even for free, the actual usage of these car seats was quite low. As a result, the research team rethought their approaches, but this time with an emphasis on patient and family respect. They looked carefully at the values that might animate Hispanic parents. With this approach, they found that one of the most important motivating factors for Hispanics was their very high level of faith and church loyalty. After recognizing this, the researchers coupled their car seat availability and education programs with the local priest, who agreed to bless each car seat in the presence of the parents. This resonance with the parents' values resulted in a remarkable increase in acceptance and high usage rates by Hispanic parents following that experience. The same approach, with an emphasis on the primacy of patient respect, might have prevented a remarkable failure that took place for a well-intentioned program in 5 southern states to provide a large number of prenatal clinics to lower-income women who were pregnant. The availability of these clinics was widely advertised and widely promoted. Unfortunately, at the end of the 3-year program study period, they found that actual usage of these prenatal clinics involved only 20% of low-income pregnant women in these states. For the other 80%, they still typically came to the hospital for the first time when they went into active labor. For this large majority of patients for whom prenatal care could be so significant, there was no difference in their usual behavior. This might cause us to ask what impact such well-meaning approaches might have if they were coupled first with pilot studies involving focus groups to help better understand what the most compelling and motivating factors might be for low-income women who are pregnant or likely to become pregnant. Such prior exploration might unveil the values, the spiritual perspectives, and even religious beliefs which might provide a framework for how to assure that the provision of well-meaning services would be strongly embraced. In this manner, we might realize the optimal goal for medical policy and medical practice to be a genuine two-way street. The ultimate reflection of upholding patient respect is to foster approaches that help the patient to become the leader in his or her own health and well-being. That way we can reduce dependency and can instead elevate human dignity and human resiliency. Finally, as we saw earlier in some of the educational activities pursued over the last 10 or more years, there remains the critical component that all education and everything that one does in medicine should be part of a continuum. Education regarding spirituality and health or healing in medicine may be helpful in medical school and nursing school, but it is absolutely vital that we improve the science of how to assure that a respect for the primacy of the patient and the well-documented spirituality framework that each patient brings to his or her own health become an integrated part of the continuing education of the entire professional life of each nurse and each doctor. I and so many others eagerly look forward to the substantial contribution that the Society for Spirituality, Theology, and Health will make, as it is ideally positioned to make critical advances in these areas. With warmest congratulations and many, many thanks.